Well, the federal government has provided an update on the battle against illegal drugs in Canada. While the numbers remain high, officials say there has been some notable decreases in some areas. Let's bring in the CBC's Janice McGregor on this story from Ottawa. So, Janice, you were listening in as those officials were speaking. What did we hear at the briefing just a short time ago about the positives and where there's still work?
Yeah, notwithstanding that there are some green shoots of progress that I'm about to walk you through, let's start with a message of clarity here. These statistics remain very sobering. Opioid deaths, hospital visits, all the stats we're about to walk through remain much, much higher than they were a decade ago. And all the officials that have spoken to reporters today emphasizing just to what extent this fight is far from over. But let's walk through some of it, starting with the deaths from apparent opioid toxicity, 5,608 in the calendar year 2025. That translates into 15 people a day dying from opioids in this country. Now, on top of that, if we look at opioid-related poisoning, opioid-related poisoning hospitalizations, people who are admitted as a result of opioid use, 4,920. That is an additional 13 people a day. And then if you look further at the number of people visiting an emergency department because of opioid use, 23,291, 64 visits a day. And if you include people who receive the care of EMS, emergency medical services, perhaps on the street or in another kind of facility because of their opioid use, that's another 39,403 people receiving care, 108 EMS responses a day on average. So incredibly high numbers still from this drug crisis. And they were emphasizing today how much more complicated it's become because the exact formulation, the composition of the drugs that are being found on the street today continues to mix. They're including sedatives, they were cautioning, the traditional kind of first line of defense. A lot of people know about naloxone kits, not always working as well now, notwithstanding the fact that they believe that the wide circulation of these kits is one of the things thought to be bringing down, in particular, the deaths in the most serious crises. We heard directly from the health minister in terms of sort of the response to this and what needs to be done. And she acknowledged, particularly because healthcare services, of course, fall under provincial and territorial jurisdiction, the federal government is somewhat limited in what it can do, but she remains, she said, a fan, a believer in the importance of safe injection sites. Here's more from Marjorie Michel.
There is no silver bullet to solve this crisis. Dogmatism and one-size-fits-all approach are not the right approaches. Health Canada does play a role in providing exemption and supporting public health responses. But it is not for the federal government to impose or dictate local implementation on these sites.
Has been a sense that this is not something that can be forced on any community that doesn't want to host one. The Chief Public Health Officer, Joss Reimer, though, said it's still her belief that they are effective, particularly in connecting people in crisis to appropriate care. There was some discussion about whether there's enough resources for various services. Of course, with the scope of the problem, that remains a challenge. The other thing that became quite evident in this news there are particularly vulnerable communities, including indigenous peoples, who are suffering disproportionately from this. They cited some statistics that an indigenous person is 10 times more likely to visit the hospital for opioid toxicity, and they account for 10 times more overdose deaths, even though Indigenous peoples are about 2% of the population. Here is Indigenous Services Minister Mandy Galmasti, who is laying out what her department specifically has been trying to fund as far as supports for those communities.
This is truly a sobering reminder of the inequities that continue to affect Indigenous communities in Canada. Behind every one of these statistics is a loved one who is missed, a family carrying unimaginable grief, and people supporting one another through healing.
And again, notwithstanding the fact that there are some general trends that are heading downward, they specifically acknowledge that there are a number of First Nations communities where they really are still in a state of emergency for opioid use, and very targeted, very focused supports are going to be necessary to pull those communities out of crisis.
Now, Janice, the Trump administration also remains quite concerned, as you've touched on, about the illegal movement of fentanyl across the border. We know the fentanyl czar was one of the officials who was there talking about Canada's progress. What more did he have to say on that front?
Well, he's taking some of these stats and heading to Washington this afternoon, he said, talking about how Canada's belief is that communicating some of the progress, some of the steps that Canada is taking on this front has, he said, abated somewhat the concerns of the Trump administration's been successful in moderating some of the language and rhetoric targeting Canada. But he also said, you know, in his view, the ideal amount of fentanyl for the Border Services Agency to be apprehending is 0. It is relatively low. I think for the last year was only 2 or 3 kilograms, an important drop, he noted. But the ideal amount is 0. Here's a little bit more from Kevin Brosseau talking about sort of how they're trying to deal with what remains for the Trump administration a top priority.
Many of the messages I've been passing on and conversations I've had with American officials have been received positively, that they're seeing great collaboration across at official level, and just simply say that to continue those efforts moving forward.
And you may remember that earlier there was a huge boost to the Border Services Agency in terms of personnel in an effort to make sure that they could get that number down to as close to 0 as possible. They were talking today at the briefing also about additional dog teams, that 1,000 more CBSA officers. The opposition has been watching the progress to get to that higher staffing level like Hawks committee. They were acknowledging that it has been difficult to get large numbers through the training facility for border officers in Rigaud, Quebec, but progress has been made, they said, in terms of staffing, even if they're not quite at the level they're shooting for quite yet. But there's a lot of aspects to dealing with this problem, including precursors, some new ones, which were only just sort of put on a list of prohibited for importation only on June 6th. So they're still watching how these drugs are produced in Canada, how they're consumed in Canada, and what they can do at the border to stop it.
Janice, thank you for this. That is the CBC's Janice McGregor in Ottawa.